Welcome back to Let's Talk 30. This episode is entitled Keep Your Noses Out of Our Uterus, Please and Thanks. And as the title suggests, we will be talking about everything infertility within this episode, and we will be joined by Dr. John Barker later in the episode. So we're going to get into the heart of our topic.
Yes.
All right. So let me just put this here. Society dictates that our adult lives follow a specific formula. Move out, get a job, settle down with a partner, get married, have a baby, retire, and then die. This is so archaic, guys. And we are not all here to procreate and then die.
Exactly.
Yeah? So, when you ask people this very probing question, when you can get a baby, it can cause stress and it can cause pressure on persons to reveal something that they may not want to reveal, or it can bring up trauma. Either way, it's none of your business, and you really should not ask people this question because it's a very nasty habit.
Yeah,
So, guys,
definitely.
how do y'all feel when people ask you, so when you can get children? Tell me. Who wants to start?
I guess I will start first because I don't find out nobody don't ask me that.
Oh,
Really?
wow.
What?
No one does not ask me when I get children.
Okay.
So
Must
my
be
parents
nice.
don't.
It must be nice.
You feel your
don't do it.
parents don't because, as you said on the last episode, your mom had you at 40. So
Right,
she
and my
would
dad had me at
kind of be
53.
right. So they would be
Yeah.
understanding of your process and just letting it happen
Exactly.
when it happens.
Yeah.
Yeah.
I think they know. Well, obviously, it's not like for y'all would think maybe it's too late to have kids after 30. They are living proof that you can have kids after 40. So I feel like they think that I will get my life together. I'm just enjoying what I'm doing now, working, traveling, and they don't pressure me. They never ask.
Mm-hmm.
My brother doesn't ask me either. So I mean, my cousins, no one really don't ask me anything. People can really ask me when I can get married, but people don't ask me about having a child.
Oh,
Must be nice.
Must be.
Yeah, I'm probably the luckiest one.
For me, my parents don't ask me either. I feel like they're very laid back and they just let me live my life. I feel like most of those questions are from random
People that should be asking you, right?
exactly.
Yeah.
Like
So your friend, like random friends, or people?
not even friends.
We're me.
Yeah,
Random
workmates.
people that just know me, know my
People
age,
that
you would
yeah.
or know that I was in a long relationship. So it's like automatic. Like,
Okay.
you've been with this person for how many ever years? When I get children?
Yes.
Or like, why when I got
Why?
children yet? Like, excuse me. Like, we are enjoying the part of our lives that we have right now. So like, just chill. I was just like, if you want to have children and let me babysit, I could do that for you. And then,
But it's-
another thing too is people always say children don't suffer, and that irritates
Okay, which is true. It's
me
true.
in such a way, because it's like, yes, it's impossible to have everything together before you have a kid, obviously. But I just feel like I want certain things in place, and if I feel like if I don't have them in place now, and I don't want to go and have a kid and then be struggling, like that's my decision. And I feel like you judging me for that decision is a little unreasonable and inconsiderate, because I mean everybody's situation is completely different.
Yes.
So it just irritates me, to be quite honest. Amongst other things that Bajans just decide that they are so brazen in asking. Like, people act like if it's not a thing,
Yeah.
And then people act as though, because I had this experience recently. Somebody that went to primary school with me, she has a child. He's about 9 now. And I saw her and she was like, well, Toya, when you can get a child? I was like, I really don't like when people ask me that. So, and then her response to me was like, she was kind of taken aback, like I offended her. Like, oh, why you got girls?
Exactly. But
So she doesn't do anything wrong for a question.
Right, you don't know, as everybody basically said, people's stories.
Yeah.
And I had a personal experience with pregnancy loss. So I personally don't like to address it. I don't like people to ask me, and that is kind of frustrating, like getting people's response when they ask me. I just give a kind of answer like, just
But
leave me
my
alone
thing
in my
is,
time.
if I were to say, if you asked me that question and I was to say, girl, I had 6 miscarriages, how would you feel?
Exactly.
Like, what are you going
You'll
to
be
say
like
to me?
taking
Yeah.
it back, like, no.
Like, you can't believe it. You understand what I'm saying? So, like, stop asking people those questions because you don't know what people are going through. You don't know if people are trying and they cannot. Like, it's just very
it's
rude and
stressful.
inconsiderate.
Yeah.
And it could really hurt people's feelings.
And on top of that is because even when I've said to somebody, oh, that happened, I had a miscarriage, the response would be, oh, so when are you going to try again?
Oh, wow.
And even when I went through that process and, the doctor said, most women want to go again right after. And I didn't feel that at the time. And I just felt like, why is it this expectation that,
Yeah.
it happens and then you have to try it again immediately after? I felt like it was kind of society pressuring me on
You
it.
too. Yeah.
And, I just want people to know, like, it's okay if you don't want to go again. I feel like I didn't have an unhappy ending. I had an ending of acceptance because this happened like when I turned 30, and I just felt like it's not my time. And that's kind of how I approached it. So even though we're made to think, oh, you're 30, that happens, maybe you should go again immediately. Like, it's okay to take a step back and kind of rethink, okay, am I ready? Is this what I want?
Yeah.
It's up to you. So it really bothers me when people ask this particular question. And most of the time I don't even want to say, well, that happened. But it has happened because I've reached a point of frustration with certain people who just keep asking.
Keep
And as you said,
asking.
I'm like, can you stop? Like, this happened. And
Yeah.
then they're just like, well, oh, so when are you going to try again?
Well, that's even
Cut it
worse.
out.
So, yeah, they clearly just
Exactly.
have no tact.
Yeah.
They
Yeah.
just don't have any tact.
Some people deal with things different ways. So sometimes you just need time to just sit back and, process it. Maybe go to counseling or,
That
as you
is
say,
it.
maybe.
Exactly. Yeah.
So,
So that would be my advice to you over 30s that, are struggling with that kind of stuff, having had a miscarriage and dealing with persons who are constantly on your case. It's unfortunate that we even have to sit and do these things.
I
so
know.
Because one of the hardest things for me when I was going through that, you don't want to tell anybody you're pregnant too early.
Yeah.
Then you're going through something when it actually happens and you don't want to tell people that you're going through that. And
Yeah.
even the process of going through that can be painful, and then people don't even understand, like, why is she acting this way? Why is she different without even knowing? So I just feel like we are just a very intrusive society.
Yes.
And we need to cut it out because at any given time, everybody is going through something, however big, however small. So just stop it.
Yeah.
Well said, sis.
Mind your business.
Yeah.
All right. So we are now going to have Dr. John Barker joining us so that he can actually give us we'll call it
He can answer some of our burning
Yeah.
questions and correct some of these.
I know these
Misconceptions.
misconceptions. Like,
Yeah.
people need to stop. So yes, he would address some situations for us and let people know that over 30, we're still good to have babies. So, as we said earlier, we would have a guest joining us. And here we have Dr. John Barker, who is a consultant obstetrician and gynecologist trained in the UK. He currently works at JRB Medical Center, and his specialist interests include endometriosis, gynecological cancers, minimal access surgery, and emergency gynecology. Welcome, Dr. Barker.
Welcome, Dr.
Well,
Thanks for having
Thank
me.
you for
Thanks
joining
for
us.
having me.
Thank you so much. So we will just start to hit you with some questions
Take it
right
easy.
off the bat. Okay, so what are the risks associated with having a baby after 35?
35 is one of the median ages, so there's not much risk unless you have like a predisposing condition and etc. However, like diabetes, high blood pressure, or like lupus or anything like that, so that's where your pregnancy would be high risk. But usually, most 35-year-old females are actually low risk. The issues will mainly start if you're over the age of 40, because likely you might have a chronic disorder like diabetes or high blood pressure. The weight in terms of like BMIs and stuff are all across the board, but mainly because of the chronic diseases having a baby over 40 would be an issue, and then sometimes getting pregnant after 40 would be an issue rather than 35, because most people in those age groups actually have a good chance of getting pregnant.
Most people in the 35 to 40 age group.
Yeah, from well, what I would say is from 20 to 40. There will be more
Say it louder for the
premium.
people in the back.
Yeah. So we're fine then.
Yeah,
We're fine.
as long as you're having regular periods and you have to have regular intercourse at least 2 to 3 times.
Right.
Well,
Yeah. 'Cause,
yeah, baby.
once we saw a patient that came for infertility treatment, and when you asked them how much time they're having sex, they said once a month. So
Wow.
Wow.
Well, that would pose an issue.
yeah, that would be a big issue. Yeah.
Okay. So is there anything that we could be doing to ensure that we are in tip-top shape as we navigate our 30s?
Okay.
But that is if we're thinking about having children
So,
on the
okay.
back end of 30.
Oh, no problem. All right. If you're thinking of getting pregnant, it's all about healthy lifestyle. So it's diet, exercise. Try and keep your yeah, you gotta eat good and healthy.
Oh,
But
But good and healthy
Love
is
that.
relative,
Yeah.
actually. But anyways,
But diet, exercise, and the reason for that is that as long as you have a BMI less than 30, yeah. What the BMI is a ratio between your height and your body weight. So as long as it's less than 30, meaning that you're not obese, then you have a good chance of getting pregnant. If it is quite high, then what we do is try to get it down to 30. And even if you're very slim, if it's less than 19, maybe 19 below, you'll have a harder chance of getting pregnant as well. So between 20 to 30 is the
Is the
ideal
target, is the goal.
target. Yeah.
and what age? Well, I guess you really said it before. What age would be the cause of concern in regards to like where we should really be scared?
Well, you're not
Like-
scared. It's just a matter of education and talking to the patient to let them understand what could happen. Everybody has the premonition that everything is fine, but yeah, and they have set goals for their pregnancy and or labor. But you have to tell them, well, sometimes it might not go to plan the way how you want. So in relation to what I would tell people is that as long as you young, fit, healthy, as long as you don't have any predisposing conditions or anything like that, you should have a good chance of getting pregnant. And in relation to age and stuff, once you get over 40, the issues would be like in terms of like stillbirths and stuff, compared to a normal, a younger person. We like to deliver at around 40 weeks. We don't let it go over because the risk of stillbirth at 40 weeks and over 40 is the same as below 40 at 39 weeks. You understand? So the risk of stillbirth is a bit higher in the over 40s age range. But sometimes, depending on what you might have in relation to diabetes, high blood pressure, etc., it might follow them a bit closely or closer because they might develop other conditions like preeclampsia and stuff.
Okay.
Yeah, but it's not a matter to say that if you're over 40, this is what will happen to
Yeah.
you. Because every patient
Everybody's
is different.
Okay. So there's been this common, well, I don't want to call it a misconception until you answer about our ability to produce eggs. As time goes on, can you let us know like what that process is in terms of, obviously it's not, as we get older, we might not be producing the same amount of eggs that we would have been producing at 25. So
Correct.
how does that really work?
Well, it's not a misconception. It's actually true. The most eggs you have is when you're a baby or when you're in your mother, because that's the most amount of eggs you have.
Wow, that's a fun fact.
Right. So what you get is atresia, and what happens is that if you have like 100,000 eggs by the time you're born, then like 25% goes, and then as they get older, they actually die off. So when you get to 30, you're actually operating on much less eggs that you had when you were much younger, like 10 or 12. So that's why like the golden age is like between 20 to 40, because after 40 is much
significant
much harder to get pregnant.
Okay.
Okay.
If persons have underlying issues, for example, PCOS and endometriosis, and they haven't had children as yet, should they be worried, or what advice would you give them?
All right, well, that's a good question. In terms of endometriosis, because we do a lot of endometriosis, if the patient is trying to get pregnant and we think or suspect that they might have endometriosis, the medical treatment will stop you from getting pregnant because anything medical is hormonal in terms of the hormones that we give you, or we can give you pain medication. But in terms of the hormone treatment, will stop you from getting pregnant. So we would suggest you to have surgery. Once you get your surgery, for argument's sake, it might involve your ovaries or tubes. So we try to remove it, excise it out, and then after that is the best thing for you to get pregnant.
So what exactly are you removing in the surgery?
Right. Well, when you have endometriosis, it is essentially like a lost scar tissue and stuff. So we would remove all the scar tissue, the actual endometriosis itself. Sometimes it affects the tubes as well. So if the scar tissue is involving your tubes, you try and remove all the scar tissue to straighten out the tubes. And then what we do is a lap and dye test, a tube patency test, to see if your tubes are normal after the surgery, just to make sure that at least that's one thing that we know working. But there is a lot of endometriosis. Usually it's about 2 in 10 people. If you got issues with fertility, it can be as high as 40 to 50% in terms of people with endometriosis. So that's why the endometriosis could be an important factor in the infertile couple. PCOS, the issue with that is that you don't get any ovulation. So as a result, you will have to give your medication to actually induce the eggs to actually start being formed. So we either give you clomiphene citrate and or metformin, which is a diabetic drug. But usually we would tell you to, if your BMI is over 30, you try to get your weight down. So that's why the BMI, as you will see, everything is trying to get your BMI down. Right?
Okay.
In terms of the surgery for the endometriosis, is that something that you would recommend women do when they're trying or at that stage of trying, or should they address that prior?
Address prior. The reason being is that the delay in endometriosis is up to like 5 to 10 years. And most people will come with what we call chronic pelvic pain. Some may get listened to, some may not. The only way to diagnose it is if you have either a transvaginal ultrasound, which can show if you have the endometriosis on the ovary, which is called endometrioma. But the gold standard is to have keyhole surgery, which is a diagnostic laparoscopy. And at that time, once we know what it is, we treat it there, and then we try to stop it from coming back. So I would advise to get your surgery before, and then you try and get pregnant after.
Okay.
And soon after.
Right?
Understood.
In regards to PCOS, I realize that it's becoming increasingly popular, and a lot of people saying that they basically didn't even know that they had it. So my question would be, like, what measures should we take to really, or at a certain age, should we then be looking into that, like checking to see if that's a possibility?
Yeah. In the pediatric adolescent group, PCOS is one of the most common causes for not getting your period for the onset.
Okay.
Right? I mean, they got other congenital abnormalities and stuff, but PCOS is up there in the top 5, right? So that can be diagnosed like as early as 14, 15 and stuff.
Wow.
Yeah? In relation to going on later in life, you can either, we do it via three criteria. So you either have irregular periods, symptoms of androgen excess, which is like acne, oily skin, hair on your chin or hair below your navel and stuff. So that is symptoms of androgen excess. If you do a blood test and it has increased testosterone, then that is one of the criteria with the androgen excess. So you might have normal features, everything, but your testosterone elevated.
Oh,
Yeah. And then you must have polycystic ovaries. But in terms of diagnosing it, you gotta have 2 out of the 3 characteristics. So either ultrasound evidence, symptoms of androgen excess, or infertility or irregular periods. So you got about 2 out of the 3.
Okay.
I didn't know
The-
why. Oh, sorry. Go ahead.
The only bummer is that sometimes they might have two, excuse me, but then the ultrasound is normal.
Oh.
So that would give you a bit of headaches.
So
Okay.
if the ultrasound is normal, what does that mean?
Oh no, you still have it because you have 2 or T3. It's just like for some people.
If
Okay.
the
Polycystic
ultrasound, yeah.
ovaries.
I don't know why I always thought like a reduced sex drive was one of the symptoms of PCOS. Is that true? Because I feel like that's something that women in their 30s would more identify as the cause of something is wrong. Because it happens.
Yeah, well, when you are investigating people who are trying to get pregnant, loss of libido and stuff is a prime candidate. The reason for this is stress. Because it's the thing they can't get pregnant, they're trying to get pregnant. Try every 2-3 times a week. They realize they ain't getting pregnant. So what we suggesting is in the guidelines that they get counseling, right? Either before, during. But most people wants to get infertility treatment. 80% of them will get pregnant in the first year, and up to 90% in the second year. Right?
Wow.
That's a great
So
success rate.
yeah. And most people, if they are going to get pregnant, will get pregnant while they're being investigated, but they will need psychological support.
Okay.
Yeah.
So that's why, like, when I set up our clinic, I made sure that we had a counseling psychologist in house. So if you got any issues, you just go next door.
Because that's half the battle. The
like
mental
that.
battle is always half the battle.
Where's
Yeah.
your clinic
Is
located?
there a
Is,
particular?
Wait, one sec,
It's
Annie.
in Bevel, 10th Avenue, Bevel, and it's JRB Medical Center.
Oh, okay.
Okay.
You could go ahead.
Is there a particular age that you should come off the pill? So I know there are some people who are worried, like, you're on the pill for 10 years, 20 years, and some people say that there's a risk of being on the pill so long, and that can affect your chances of getting pregnant. Is that true, or is that something?
Not per se, but the main reason why you're on the pill is to prevent pregnancy. So once you then decide you want to get pregnant, because got different levels of contraception. So they got like your long-acting reversibles, which would be like Depo, Bavaria. You got your Mirena card, or you got your copper T, all right? Or you got your oral contraceptive pill, which could be combined or not. If you're on the pill for a long time, usually when you stop, we give you up to 6 months to get back your periods and stuff, because you got to understand that the hormones suppress all your different hormones. The pills suppress all your hormones. So once you take that out, if you're lucky, within the next cycle, you get back your periods. However, some people can take up to 6 months or a year to get back. So usually if you don't get back your period within 6 months, we will investigate you to see if there's something else causing it, because it can be the suppression from the pill, or you can have another disorder
Something
that's
else.
stopping you from getting
Like
your
a
period.
6-month mark.
Yeah.
And then
So
can
usually
start.
get 6 months.
Okay.
Okay.
One final question for me. Mindful of your time. What are your thoughts on alternative? I know you mentioned infertility treatment just now, but how do you feel about freezing eggs, and what would be the ideal age where you think we should start this process? If we're thinking that, it might not happen by 40 and we want to do it in our 40s, would you recommend freezing eggs, and at what age would you start that process?
But it all depends on the person. But around 35 is fine.
Around 30, up to 35?
Well, I would say around up to 35 is fine. But the younger you are, the better quality of the eggs. And then, like, for argument's sake, if you're trying to get pregnant and you're like over 40 and you gotta go for IVF, they would tell you that you need donor eggs.
Really?
Yeah, because the quality of the eggs of 41, 42 are not as good as a younger person's eggs.
35, wow.
Yeah.
Okay.
But it's just that over 40.
Yeah,
we
I
understand.
understand that, but like to actually start the process of freezing eggs at 35.
Yeah, but but I would advise, in terms of freezing eggs, you will have to speak to the infertility specialist, because I'm not sure if they freeze eggs here or what. So I'm not exactly 100% sure.
Okay.
But you have to talk to your fertility specialist, IVF specialist.
Okay.
All right. So you guys have any more questions?
I think he covered my most pertinent questions. If he has anything else he wants to share with us, because our thing was, you know, once you reach that 30-year-old mark, people are always on your case.
Definitely.
And
No, that's a bit
they use
insensitive.
science to challenge you on it, as in
yeah.
you're not going to be able to do it if you keep taking this long. So we just wanted to really have you on to correct a lot of those misconceptions.
Yeah,
And I think the information was really good.
What you will find is that your family gives you a lot of pressure to get pregnant, and if you're not getting pregnant, they might not even understand that you may got an issue like endometriosis
Yes.
or some of the issue
Yeah.
going on.
Yes.
So actually, they
Not
may
only your
mean
family.
well, but they're actually working against you.
Yeah.
So just tell the public why they should not ask people when they're gonna get a baby. Or
It's a bit embarrassing, and it puts you on the spot. Sometimes it can be seen as insulting, but it all depends on the person. Some people might laugh it off. Some people might be extremely offended, or some people may actually be quite deeply hurt because everyone has a story.
That's
but
the
you
one
might
that
not
bothers
even know
me.
the
It's
story.
traumatic.
Yeah.
part
And
of
it's something
for
that's
me.
personal as
it's
well.
Trauma. Yeah,
You might not know
So-
the story.
exactly.
Yes.
So can y'all keep your noses?
No.
Out of our uterus.
Sorry,
Please
correct.
and thanks.
Thank you.
Well, thank you so much
No
for
problem.
joining us.
No
Thank
problem.
you.
Thank
Thank
you.
you.
It was very
Definitely
informative.
appreciate
Very
it.
cool.
Great. So, thank you so much for taking the time to listen to another episode of Let's Talk 30. I really do hope that you enjoyed this episode and that you learned something. Yes. All right, so you can actually find us on all the podcast platforms. We are on Spotify, Apple, YouTube, and you can follow us on IG at Let's Talk 30.bb. Always remember, life is too short to live counting the years. So, if you're on your journey to or through 30, enjoy the ride. See you next time.